Okay, good morning. Good morning, everybody. In today's lecture, we're going to look at how signaling molecules or any kind of ligands, so drugs, etc., actually bind to receptors. So we're going to talk quite a bit how to mathematically describe the binding of various kinds of molecules onto receptors. So today is going to be mostly about maths, but it's not going to be a very difficult mathematics. And you'll see that you actually all know it already. So that's the goal of today's lecture. Look at the binding of ligands onto receptors, different kinds of bindings, different kinds of ligands, different kinds of effects. Okay? So first of all, you all understand the term ligand. What is a ligand? It is a substrate. A substrate.
Signal molecule.
Okay. That doesn't really help us. It's not much of a definition, but okay. You're right, but
It's like a key to a lock.
It's like a key to a lock. Okay, so that's a nice simile. Okay. What is a? Could anybody define a ligand? You've all had medical terminology, so going back to your Latin, what is a ligand?
Binding molecule.
Excellent. Who said that? Yeah. Okay. It's something that binds. Okay, that's all it means. So a ligand is something that binds to something. In inorganic chemistry, when you form complexes, when you form coordination compounds, the stuff that binds to the central atom, they're all called ligands. Okay, so ligand is just something that binds. You're right that it could be a substrate if it binds to the active site of an enzyme. It could be a drug, it could be a signaling molecule, it could be all sorts of things. So ligand is just something that binds. Okay, so it doesn't have any more specific meanings. Later in this lecture, we're going to mention some classification of ligands from a pharmacological point of view. So there will be a different classification, but all the molecules that bind to receptors or other things are called ligands. So that's just so we understand each other what we're talking about. Right. So we have, yes?
Are cofactors ligands?
Are cofactors ligands? In a chemical sense, I guess they can be, yes. Yes, they can be. Yeah. Okay, a ligand kind of tells you that it can bind and then be released often. Well, yeah, I guess they can be. Yeah, they can be ligands. But we're not going to be talking about cofactors today. Okay. Right. So on one side, we have receptors. On the other side, we have ligands. How can we, and you all know that, how can we mathematically describe what happens when in a test tube when we have receptors and we have ligands? Is there any way to describe what's going to happen when we mix the two together?
Km.
Km. Km. What is Km?
Constant equation.
Okay, Km constant equation.
Yeah,
that's all. Huh? The Michaelis Constant. Okay. The Michaelis Constant is something to do with enzyme kinetics, and there is something. You'll see in a minute that there are some parallels between that. But it's not Michaelis Constant that describes it.
You can set up how many ligands are bound to receptors, how many are not bound to receptors.
Okay, so you can measure the amount of bound ligands to receptors and unbound. That's true. That's what you can measure. What can you do with that measure?
Set up affinity. Affinity?
Affinity. Yeah, we can find the affinity. What is the affinity?
The ratio of the bound receptors compared to the non-bound.
Okay, so the affinity.
The attraction of a substance to a receptor or genetics.
Okay, the attraction of the ligand to the receptor, the ratio between bound and free receptors and receptors with ligand. Okay, we're kind of getting there. And there is a very general way to describe this kind of system in chemistry, using a constant, but not the Michaelis constant. The equilibrium constant. Okay? If we mix receptors and ligands together in a test tube, in the end, well, probably pretty quickly, we get into an equilibrium where some part of the ligand will be free, some part of the receptors will be unoccupied, and a bit of the receptors will have a ligand bound. Okay? And we get an equilibrium. So we have a general reaction, free receptor plus free ligand. And we get a complex of receptor and ligand. Okay, that's the general reaction. So if we want to find an equilibrium constant of this reaction, what is it going to look like? The expression. Just a general equilibrium constant.
RL over R plus M.
Okay, so the equilibrium concentration of RL, of the complex, divided by the product of the concentration of free receptors and free ligand. Okay?
Should we use another pen?
I think I can. I'm not sure it's going to help very much. Yeah, well, for how long? That's the question. Okay? But this is something you've seen so many times that this shouldn't be something you need to take down notes or something. Okay? The general equilibrium constant, it's always done like this. Okay? Now, when we're talking about receptors, especially in pharmacology, we actually, and I'll just come back to what you said, that we're interested in affinity, we're measuring affinity. The equilibrium constant is the measure of affinity. Okay? So when you said that it's the ratio of occupied to unoccupied, actually this ratio is a measure of affinity. Okay? But that's, yeah. In pharmacology especially, instead of this equilibrium constant, we use the inverse constant. So the equilibrium constant for the reverse reaction. And this constant is called dissociation constant, KD. Okay? So how is that going to look like? It's just an inverse of that.
Inverted.
Indeed, it's an inverse, so I would invert it. So can you tell me what's going to be where?
Numerator and denominator will be swapped.
Okay. All right, okay. Okay, so this is the equation for the dissociation constant. Okay, a very important measure of affinity. Okay, and we'll see in a minute what the actual number, what the actual value of that tells us about the binding of ligands to receptors. Okay, so far this should be familiar to all of you because we've done this in many different contexts. Right, now you mentioned that we're going to mix, in order to find out the affinity, we're going to mix ligands with receptors and we're going to measure some stuff. So the question that I have now for you to figure out is, how do we measure the dissociation constant? Okay, so let's spend 2 or 3 minutes talking to people around you and try to design an experiment how to measure the affinity, how to measure the dissociation constant of a receptor with a ligand. Okay, try to find out how to do it. 2 minutes. Okay, I think the 2 or 3 minutes have passed now. So give me your suggestions. How would you measure the dissociation constant of a receptor with a ligand? Yep.
You need some stuff which is made of, which is a complex with a ligand and a receptor first, so you can dissociate it. Can you make that?
How would you do that? Well, the one way to make a complex of receptor and ligand is to mix the two. But obviously, there's an equilibrium going on there. So once you try to purify the complex, the ligand is going to just, dissociate. So your suggestion would be start with complex, then let it dissociate and just measure the two values. Yeah, is that okay? Yeah, I don't think that's going to work. No.
pH,
Hmm?
pH.
pH, how would you measure?
I just thought about it. Dissociation.
Yeah, it's a different kind of dissociation. I mean, yeah, the pH or proton exchange can play a role in this, but let's not complicate things. Yeah?
Does it have anything to do with the concentrations? Like,
Yes.
okay, well, it's possibly similar to the KM principle, so if there's like higher concentrations, there would be a lower affinity. So like, so there's some kind of like...
There might be, but
I'm just questioning what...
concentration of what, where?
Of the ligands, like, and yeah, the ligands attracted to the receptor. Or, yeah.
Let's possibly, quite possibly, but how do you measure that? That's my question. Yep.
The dissociation constant is the opposite of
the association constant.
Of the
Yes.
Association constant.
Yes.
So what you don't associate, is dissociated. So you take 1 minus, or the actual.
Oh, sure. Yeah, but we don't even know this though.
We don't know.
No. That would be too easy.
Could you do it with spectral photometry maybe? If the bound ligand and receptor have a different spectrum of light that absorb, and then you can look before and after and measure the drop.
Okay, so yeah, using spectrophotometry with the complex having different spectral properties. Okay, so you would start up with a solution of free receptor. Then you would add a ligand.
Yes, and then I would keep adding until maybe we reach maximum. And then calculate it from there.
Okay. Okay. Okay, that's a very interesting suggestion. So what you're saying is, assuming that there is a change in spectral properties in the complex. So for example, the ligand itself has some kind of spectrum, but when it binds to the receptor, the spectrum changes. Okay? So you keep adding it and measuring how much of the changed spectrum you have in the solution until you reach the maximum.
So that should give you a rough indication, I guess, when all the receptor ligand is bound.
Okay. Okay. Okay, that's a very good suggestion. It's not the way it's done, but in theory, it could sort of work. There's one big problem, which I sort of didn't tell you in the beginning, but the problem here is we generally don't know how many receptors we have. Okay? So we start, for example, with a tissue homogenate, like, brain homogenate, that's very often used, and there's some number of receptors, and we just don't know how many receptors they are, and very often we don't even know what they look like. We don't know what the receptors are, but we just need to find out what KD is. So your suggestion is very good, but for that to work, you need to know how many receptors there are in the solution. In that case, that would work. If we don't know, which is often the case, how many receptors we actually have, we have to use some other tricks. Yeah? Do you want to? Yeah?
I don't know, maybe from the outcome of the pathway they get related to.
So the effect of the binding. So you would measure the effect of the binding, and from that, figure out how much binds. Okay, very interesting idea. And in a few minutes, we're going to talk about the relationship between binding and effect. And we'll see that it's a little bit more complicated for this to work. Okay, very good suggestions. So I now tell you how it actually works. So with the example of brain homogenate, okay, do you know what a brain homogenate is? No. Okay, you just take a little bit of brain and you just mash it up. And that's brain homogenate, okay? Very simple thing. Obviously, all the receptors, if you're careful at least a little bit, all the receptors are there, okay? Just not in the original structure, but we don't really care about the original structure before, okay? The receptors are floating around in this brain mush, okay? That's what you get. So what do you do if you want to find out the affinity of a specific ligand to those receptors? You start with the radioactively labeled ligand. Okay? So the ligand we're interested in, you label it radioactively. Now what you do is, you add a little bit of the ligand, you mix it up with the brain, and then you centrifuge the brain membranes down, and you measure the radioactivity in the brain and in the solution. The radioactivity in the brain stuff is this. Okay? Does it make sense? Okay, and the radioactivity in the supernatant is this value.
One more time, please.
Okay, so you have a mixture of receptors. Okay, now it doesn't really matter if it's brain or whatever. You have a solution of receptors. Okay, you add a radioactively labeled ligand. You let them associate, and then by centrifugation, you separate the free ligand and the bound ligand, because the bound ligand is bound to something that's heavier than all the other stuff. So you can centrifuge it out, and you can measure the radioactivity between the two. Does it make sense? Yeah? So, we get sort of this value. In fact, with the Czech students, we had quite a long discussion about the fact that the radioactivity itself, the value of the radioactivity, doesn't actually tell us the absolute number of receptor ligand complexes or the absolute number of free ligand, because we don't know how radioactive it is. We don't know how many ligands are bound to a receptor. But as you'll see, we don't actually need to know that. Okay? So we get some value of radioactivity in the brain, which is somehow proportional to this, and we get some radioactivity in the free solution. We actually don't need that very much either. But we still don't know this value, and without this value, we can't really calculate the affinity. Yeah? Do you see that? That's a problem? Okay. So what we do is we actually do a little bit of a trick. First of all, we define the value of the receptor-ligand complex as just a different letter, okay? We call it B as in binding. So that's our value of radioactivity in the spun-down brain. Okay? Do you all see that? I'm just renaming it so that I don't have to write as many things, okay? This is a very simple thing. So the receptor-ligand complex, I'm going to call binding at a specific concentration of ligand, okay? So as I increase the concentration of the ligand, binding will increase, okay? That's how it works. Good. Now the other definition is going to be a bit more maybe demanding for the thinking, but anyway. The number of bound receptors plus the number of free receptors is going to be equal to B max. The number of bound receptors plus the number of free receptors is the number of all receptors that we have. Do you understand that bit?
Yeah.
Okay? The receptors in the solution, no matter how much ligand we add, is always going to be the same. Okay? We just added a certain amount of receptors. We don't know what the number is. We don't know what the amount is. But it stays the same no matter what we do. Okay? So this will change and this will change, but they together will be constant. That's the total number of receptors. Now, why do we say that it's equal to B max? B max is the maximum binding. So imagine we add an infinite amount of ligand to the solution. So all the receptors in the solution will have a ligand bound. Okay? So at an infinite concentration of ligand, B is equal to B max. Okay? So let's actually show it graphically. Yeah, there's a question? No? Okay, so this is the ligand, this is the radioactively bound ligand, radioactively labeled ligand, this is the binding. So we start with 0, there'll be 0 binding, okay? And then we keep increasing the concentration of ligand, and in the end, at infinity, it's going to reach B max.
Okay, raise your... No, that's ligand, right? At the bottom?
This is ligand L, okay, yes. And this is B for binding. Okay? We could also call it RL or RL or complex or whatever, but that's binding because we redefined it. Okay, raise your hand if this makes perfect sense. Okay, most people. Okay. Right, so do you understand how we defined that the total number of receptors is equal to B max? Again, it's not actually equal. It will be equal to this times some constant, and this is also not quite equal. It's actually equal times some constant. I don't want to complicate it too much, but as I said, we don't know how many molecules of the ligand bind to a receptor. So we can't say this is exactly equal to this. It's going to be multiplied. So imagine you have 100 receptors, okay? Now, if they each bind just one ligand, B max is going to be 100 times some radioactivity stuff, but that doesn't really matter. If they all bind two ligands, it's going to be 200. So this is the constant that we don't know. We don't know how many ligands a receptor binds, okay? But these two constants are the same, so they're actually going to cancel out. Okay? But I'm just saying this to make this mathematically correct, okay? But it works even without the constant. Okay, raise your hand if you're now more confused than you were before. Okay, good. So it's working fine. Now, the final step in all the mathematics is basically using these definitions and this formula to get something from which we can actually measure and calculate the KD, the dissociation constant. I'm not going to go through the whole derivation, but the end result is that B over B max, okay, this is where the two constants cancel out, but that doesn't really matter, is equal to L divided by L plus KD. Okay? If you're bored in the evening, you can try to do the whole derivation. It's not that difficult, it's just rearrange, it's just algebra, it's just rearranging things. Now, before you start trying to remember this formula, I'm just going to slightly rearrange it and make it a lot easier to remember what it is. So I'm just going to multiply both sides by Bmax. Okay. I'm going to multiply both sides by Bmax, and we're going to get B is equal to Bmax times L divided by L plus KD. And now all of you are going to say, oh, we've seen this before. So what does this formula resemble? What does it look like? Exactly. Okay, it looks exactly the same way as Michaelis-Menten equation, as enzyme kinetics equation. Okay, only in the enzyme kinetics, instead of B, we have V, so the velocity, the speed of the reaction, and instead of Bmax, we have the maximum velocity. Otherwise, and instead of KD, we have Michaelis constant. But otherwise, the form of the equation is exactly the same. Okay? So pretty much, you can forget everything that I was talking about. That was just so that it makes sense to you how we get it. But in fact, if you remember Michaelis-Menten equation, you can easily figure out how this works as well. So in the beginning, there was some mentionings about Michaelis-Menten that there is some parallel. And indeed, there is some kind of parallel. Obviously, KD is not the Michaelis constant. Okay? It's a completely different thing. But the form of it is the same. Now, what is Michaelis constant? How would you define? How would you explain it to somebody?
The rate, the substrate, the concentration where the velocity goes after maximum.
Okay. Okay. The Michaelis constant is the concentration of the substrate at which the reaction is half maximum. Right. What is KD then? Speak up.
The half of Bmax, or half of the rate of Bmax, I guess.
No.
No.
I mean, you're close, but that's not right.
Is the ligand concentration where the is Bmax?
Excellent. Okay. So it's the ligand concentration at which the binding is half maximum. Okay? It's an exact parallel with Michaelis constant. Okay? It's just a different system and we're measuring different things. So it works the same way. So the dissociation constant is the concentration of the ligand at which the binding of the ligand to the receptor is half maximal. Raise your hand if this makes sense. Okay. Let's try that again. Raise your hand if it makes sense. Okay, most people. Good. So how do we guess the affinity of a receptor based on the dissociation constant? We have two receptors, one of them has higher KD, the other one has lower KD. Which one is going to have higher affinity? Okay, take your time, think about that. Okay, the lower KD. The lower dissociation constant says that it's higher affinity. Okay? So, that'd be great if you could remember that. Excellent. Any questions to this? I could see that not everybody raised their hands. So if anything here is unclear, even what these means or whatever, just tell me now because we do have time to explain it a bit better.
You're saying that it's not the same, but at the same time you're saying that lower KD is higher affinity, and that's the same as Michaelis-Menten's, right?
Yeah, why I'm saying that it's different is that here we're measuring the binding, while there is actually a reaction going on. So there are actually some more assumptions in enzyme kinetics. But it's true that even Michaelis-Menten kinetics is derived from the binding of the substrate. So it's a different process, but it's described mathematically at a very similar, in a very similar way. Okay. Yes?
But when you don't know R or KD to begin with, how does Bmax work?
Well, that's the thing. If we basically make these definitions, we don't need R because it just disappears, because we just measure Bmax. Okay, that was the whole point of this complicated thing. It's mathematically we can manipulate this in order to get a value that we can measure without knowing the number of receptors. Okay, yeah, maybe if you have time later, just look at what we did here, and it's just basically constructing something that we can measure from things that we can't measure. Okay. Yep. So KD is the concentration of the ligand at which the binding is 50% of maximum binding. Okay, again, it's an exact parallel with Michaelis Constant. Any other questions? No. Okay. Before we take a short break, let me just make the transition to the next topic that we're going to be talking about. So this was all about binding to a receptor. Now, binding of a ligand to a receptor is the necessary condition for something to happen, but it's not the sufficient condition for something to happen. Okay? So the effect of the binding is somehow related to the binding, but it's not the same thing. So the fact that a ligand has bound to a receptor does not mean necessarily that we get an effect at all, or that the effect is directly proportional to binding. So what I'm saying now is that the effect and the binding are related, but they're not the same thing. Now, in order to be able to talk about different kinds of ligands, especially in pharmacology, I'm going to give you a little bit of terminology that's used when talking about various drugs. And it's related to this binding to effect coupling. Okay? Can I erase that? Yeah. So all the signaling molecules that you've been talking about until now, when they bind to a receptor, they cause an effect. Okay? That's the whole point of having signaling molecules. Okay? In pharmacology, these kind of molecules that bind to a receptor and cause an effect are called agonists. Okay? So agonists are just normal molecules that bind to a receptor, cause an effect, usually cause the activation of the receptor. Okay? Agonists. Now, we have another group of molecules, of ligands, called antagonists. What do you think antagonists do? Okay, that is actually not true. They do not have the opposite effect. They have no effect. They do not cause the activation of the receptor. Okay? Sometimes they block the receptor, but not always. Okay? So one thing to remember, antagonists do not cause the opposite effect. They just do not activate the receptor. Okay?
So they also don't inhibit the receptors? Like for example, Gaba, would you consider that an antagonist, or is it just a
The inhibitory agonist.
GABA on GABA receptors. That's an agonist.
Agonist.
Yes, yeah. So activation of a receptor, I mean the receptor itself can be inhibitory, but it's still activated.
Yeah.
Okay, so this is, yes?
Why should we care about them if they do nothing?
Why we care about those is that very often they sit at the same place as the agonist would. So they can displace, and we're going to talk about that, they can displace the agonist from the receptor. So they sit there, don't do anything. So the agonist that would like to do something cannot, because there is an antagonist sitting there.
So it's like a blocker.
It is like a blocker, yes. But we're going to talk about different kinds of antagonists in the second half of the lecture. Okay? So that's why we care about them.
Were they bound to the same receptor?
Sorry?
So agonist and antagonist would bind to the same receptor?
Let's leave that to the second half of the lecture. I'm going to talk about the different kinds of antagonists. Sometimes they do bind to the same place, sometimes they don't bind to the same place. Okay? We're going to talk about that. So this is just the terminology, okay? I'm going to explain everything later. So we have agonists, we have antagonists. There are two more groups of ligands that are a bit more complicated, and again, I'm going to talk more in detail about them in the second half. The first group is called partial agonists. So these are agonists that activate the receptor, but not as much as full agonists. Okay, so these actually we can also call full agonists. And we have partial agonists. And the last group are called inverse agonists. And those are the molecules that cause the opposite effect from the agonist. Okay? So we have full agonists, they fully activate the receptor. We have partial agonists, they partly activate the receptor. We have antagonists, they just sit there and don't do anything. Usually inhibit the binding of the agonist. And we have inverse agonists that cause the opposite effect of the agonist.
But wouldn't that be not causing any effect, like antagonists?
No. And I'll explain that later. Okay? I do understand your point, and in a way you're correct, but there's actually a little trick around that. Okay, so this is just terminology, and we're going to take a 5-minute break, and then we're going to talk more in detail about these things. All right. Do you have any questions about what we did before the break? Yep.
I do. Can you explain me any concrete situation but in which the cell uses a partial agonist and in which?
Okay, let's leave partial agonists for the end of the lecture. Okay? I'll explain that in a bit. Any other questions?
I also used to that about the short answers.
Right. Okay. Okay. So for in the test, there was a question: what kind of short answers will there be? Now, I can't speak for all the short answers. I haven't seen them, but our short answers are going to be about metabolic pathways of some signaling molecules, putting in names of enzymes, names of compounds, names of reactions. And there's going to be something about signaling cascades as well. Okay, so it's going to be mostly filling in or some short word or few word answers. Yes?
Drawing.
The ones I've seen, I don't think there's any drawing of structures or anything like that. No. Okay?
Signaling pathways or synthetic pathways?
Both.
Right.
Okay? So that's, yeah, but as I say, I haven't seen all of them. So, yeah. Okay, there are no more questions about the first half. Just before the break, I said that it's important to keep in mind to keep in mind that the binding to a receptor is not the same thing as the effect on the receptor. One reason for that is that we have different kinds of ligands that cause different levels of receptor activation. But there is another reason why binding is not the same thing as effect. And the other reason is called spare receptors. Okay? Spare receptors is a term in pharmacology that basically describes a situation that's very common in our tissues. And that is that often a cell will have many more receptors than are needed for maximum effect. Okay? Let me just say that once again. Very often cells will have more receptors than need to be activated for 100% of effect. Okay, so imagine a cell with 100 receptors, but for the maximum effect, we need only to activate 25 of them. So there are 75 receptors that are just sitting there. Those are called spare receptors. Okay, now a good way to imagine that, for example, in a skeletal muscle, there is only a limited number of myosin heads that can actually cause the contraction. Okay? For example. Now, imagine that on a skeletal muscle, we have 100 receptors for acetylcholine or something. But when we activate 25 of them, all the contractile proteins have been activated. So activating the other 75 receptors will have no more effect. We're already at 100% effect. Okay, does it make sense? Good. So spare receptors are very often actual spare receptors, so there are more receptors that are needed. But there's another mechanism for this spare receptors phenomenon, and that's something that you've heard about before, and that's the amplification of signaling cascades. So from one G protein coupled receptor will activate several G proteins. Each G alpha subunit will activate several molecules of adenylate cyclase. Each molecule of adenylate cyclase will produce thousands of molecules of CAMP. CAMP will activate, etc., etc. So there's a huge amplification in the signaling cascades, which is the other reason why we don't need to activate that many receptors in order to get 100% effect. Okay? So again, the relationship between binding, so 100% binding usually means 100% effect if it's an agonist. But a 50% binding can still be 100% effect. 25% binding can still be 100% effect because there are often spare receptors. Okay? Do you all understand this concept? Good. So let's now have a look. We're not going to talk very much about full agonists because from a pharmacological, or from this point of view of binding and effects, there's nothing interesting there. A full agonist binds and activates the receptor. So what we're going to talk about in more detail now are antagonists. Okay? So let's talk about different kinds of antagonists. Now, in the first half of the lecture talking about binding, you see that there were very close parallels between binding to receptor and enzyme kinetics. Now, talking about antagonists, there are again very, very close parallels between enzyme inhibitors and receptor antagonists. So the classification of antagonists and how they work will be actually very similar to what we did when we talked about enzyme inhibition. Okay? So we have two basic kinds of antagonists: competitive and non-competitive. Okay? Competitive antagonists bind to the same place as the agonist. Okay? They bind to the same place, but do not activate the receptor. Those are competitive antagonists. Of course, competitive antagonists, in order to be competitive, need to be also reversible. Competitive antagonists are also reversible. Okay? Because they need to compete about the same for the same place on the receptor, so they have to be able to dissociate. Okay? So competitive antagonists are reversible antagonists, and they compete for the same binding space, for the same binding place as the agonist. So what is the... Now let's try to have a look at the binding of an agonist, actually, so that it's clear. The binding of an agonist in the presence of a set concentration of a competitive antagonist. Okay, do you see what I'm saying? Okay, we have a test tube, there are some receptors, we add a little bit of antagonist, and then we add more and more of agonist, and we look at the binding of the agonist. Okay, so this is the parallel situation to having an enzyme with varying concentrations of substrates at a given concentration of an inhibitor. Exactly the same thing. So without the antagonist, this is what we get. That's the binding of an agonist. We just looked at the maths, so this is what it's going to look like. How is it going to look like in the presence? So absence of antagonist. How is it going to look like in the presence of a competitive antagonist?
Less steep.
Okay, it's going to be less steep.
It will reach the same maximum.
And we're going to reach the same maximum. Okay? Again, same thing as with competitive inhibitors. Okay? So Bmax is the same, but Kd is larger.
Doesn't that depend on the affinity of the agonist or antagonist to the receptor?
Yes, of course it depends on the affinity of the antagonist and the agonist to the receptor. So if we have an antagonist that has a very, very high affinity, the difference in the KDs is going to be larger. Okay? If we have an antagonist with low affinity, the difference in the KDs is going to be smaller. Okay? So the exact place, the exact difference will depend on the ratio of the two affinities. That's true. Okay? Now, this KD that I labeled KD slash dash, rather, prime, is not an actual KD. It's something that's called apparent KD, apparent dissociation constant. Okay? So this is something that we measure. We do all the experiments that we talked about. We measure it in the presence of an antagonist, and we get a shifted KD. But it's not an actual KD. It doesn't describe anything. It's just some ratio of some other KDs plus something. Okay? So just so that you don't... This is the actual KD of the receptor to the ligand. This is apparent KD in the presence of an antagonist. Okay? It still describes the apparent affinity, but it's not the same thing as KD. Don't worry about it. You won't need to know this. I'm just trying to prevent any confusion that the KD somehow changes. It doesn't change. The KD of the receptor is still the same, but there's some molecules of antagonists sitting there preventing the agonist from binding. Okay. Anyway, what you need to know is it's the same as competitive inhibitors. Vmax is the same, but the apparent KD is increased. Okay? So the apparent affinity is decreased.
So we're talking
Yes.
about binding and effect at the same time, aren't we?
No, this is binding.
But what's the difference between binding of...
Very good question. What's the difference between binding and effect? So this would be the effect in the absence, and this would be the effect in the presence. Okay, so it looks exactly it looks exactly the same. Hmm? That's in the presence. That's in the presence. Yes, it's in the presence of antagonist. So it looks the same. So this would be the maximum effect. And these two values are something that we haven't talked about yet. But these two values are obviously not KDs, because we're talking about effect. And as we said, it's actually a bit more complicated with effect. So what the EC50. So 50% effective concentration. Okay? And this would be the other one. Okay? So for binding, the affinity is expressed as Kd, as dissociation constant. For effect, it's the half maximum effective concentration. Now, if there are no spare receptors, Kd and EC50 are the same. Okay, I'll slow down a little bit because I can see that people are still taking notes of things that I talked about a minute ago. So once again, if we talk about binding, these parameters are called dissociation constant. We're talking about effect, these parameters are called EC50, or half maximum effective concentration. So that's the concentration of a ligand at which we get half maximum response. Here we get half maximum binding, here we get half maximum response. Okay? And once again, in the absence of spare receptors, Kd for a ligand and EC50 for a ligand are the same. In the presence of spare receptors, if there are spare receptors, EC50 is going to be, what do you think it's going to be? So, no spare receptors, Kd is equal to EC50. With spare receptors, how is it going to work? What's going to be the relationship between EC50 and Kd?
EC50 will be smaller.
Why is it going to be smaller?
Well, it's going to be less effect because agonists can still bind to the spare receptors.
The antagonist level.
Yeah, I'm not sure I understand your explanation.
Yeah, I'm not speaking to myself.
Okay. But the EC50 is indeed going to be lower than Kd. And the reason being is, again, we have 100 receptors, but we only need to activate, well, to make it easy to calculate, we only need to activate 50 to get maximum effect. Okay? But we need so at 50 occupied, we get Emax. But at 50 occupied, we only get half Bmax. Yeah. So imagine we have 100 receptors on a cell, but in order to get maximum effect, we only need to activate 50. The other 50 are spare receptors. Okay? So we add ligand that binds, we add a ligand concentration at which 50 receptors are occupied. Okay? Now, for binding, that's just half maximum binding. Only 50% of receptors are bound, have a ligand bound. Okay? So that's only 50%. We're nowhere near Bmax. But for effect, we're already at Emax because we only need 50% of receptors to be occupied to get maximum effect. So, yeah, I don't want to draw the whole complicated things, but basically the Kd, the value of ligand at Kd, will be equal to the value of Emax, basically, or the concentration of ligand at Emax. So the EC50 actually is going to be lower than that.
So we get the full effect, but Bmax is going to be half.
Not Bmax, binding, B is going to be half. Let me draw a new graph. Can I erase this? Yeah, this is the same as with enzymes, so we don't really need to keep that.
So half of Bmax is Emax?
No, well, not really. No. So this is the concentration of an agonist. We just keep adding it, and we get Kd. Okay. Now, we added, okay, I'm not going to call it KD. I'm going to call it X. To our cell with 100 receptors, we added X concentration of a ligand, which gives us exactly Bmax over 2, 1/2 Bmax, because 50% of receptors, okay? But if we look at effect, so it looks like this. Concentration X is here. Okay, that's actually, sorry, that's really confusing. Because I was using 2 different x-axes, which just would, yeah. So it would look like this. Okay, so at X, we already have Emax. Because there are 50 spare receptors that we don't need. So that means that the actual EC50 is going to be somewhere here. And this is KD. Okay? Put your hand up if you understand that.
Yeah, that's obvious, but...
Okay. Fine. I just wasted my breath now. For, okay.
What I mean is that if you have the spare receptors, they are susceptible for antagonists and agonists.
Sure.
Why doesn't it stay the same? Why is KD smaller or bigger than EC50?
This has nothing to do with antagonists. Well, it has to do with antagonists, but now I kind of I took a step back and I'm just talking about binding of an agonist in the absence of any antagonist. Okay, it will become clear how it's related to antagonists in just a minute, but this was just binding of an agonist in the absence of any antagonist.
KD is bigger than EC50 in absence of antagonists.
For situations where there are spare receptors, yes. Okay, now, I don't want you to think about these things as being weird, complicated mathematical expressions, okay? That's why I'm trying to use the example of having 100 receptors on a cell. And when you occupy 50 of them, that's KD, but you get maximum effect. So that's why KD is bigger than EC50, because EC50 has to be smaller than the maximum value that gives you an effect. Okay? So I think conceptually it's actually relatively a simple thing. It's just maybe I started with too much mathematics and too many graphs to show that. Okay? So the thing to remember is that if there are spare receptors, which is the case most of the time, KD is larger than EC50. EC50 is going to be smaller. Okay? Now, this was just binding of an agonist in the absence of an antagonist. Okay? Now, let's go back to our antagonists. Let's go back to our antagonists, and let's talk about the other group of antagonists, and it will become clear why I started talking about this. And those are non-competitive antagonists. Non-competitive antagonists behave again sort of similar to non-competitive enzyme inhibitors. There are 2 large groups of non-competitive antagonists. One are allosteric allosteric antagonists. And the other group are irreversible antagonists. Okay. Now these two characteristics can combine, so we can have an irreversible allosteric antagonist. Yeah, but let's not go into that. So do you understand why allosteric inhibitors are non-competitive? Yeah, because they bind to a different site than the agonist. So adding more agonist will have absolutely no effect on the binding of of the antagonist. So we can't displace the antagonist by increasing the concentration of the agonist, which makes them non-competitive. Okay? The competitiveness of competitive antagonists lies in the fact that we can displace them as we increase the concentration of an agonist. That's what defines competitive antagonists. They can be displaced with higher concentrations. For allosteric antagonists, it's non-competitive. We can't displace them by adding more agonists because they bind to different places on the molecule. Does that make sense? Okay. Similar thing is true for irreversible antagonists. I mean, they can bind anywhere on the molecule. They can even bind at the same place as agonist. But once they are bound, we can increase the concentration of agonists however much we want, but we can't displace them because they're irreversible. They just sit there, and they will sit there, till the end of time. Make sense? Okay, raise your hand if that makes sense. Good, great. So, what is, yes?
So essentially, you're saying that KD would just be the same.
Well, let's have a look at that. Okay. So this is the graph for binding. Okay, just pay attention to what I'm drawing because I know there have been many graphs that look very similar, but they were about different things. This graph is the binding of an agonist in the presence of a non-competitive antagonist. Okay? So again, we added a little bit of non-competitive antagonist, and we're increasing the concentration of an agonist. So in the absence of the antagonist, this is what it looks like. What does it look like in the presence of a non-competitive antagonist? Exactly. We're never going to reach Bmax. Okay? Does it make sense why we're never going to reach Bmax? Because some of the receptors will be occupied by either allosteric or irreversible antagonist, and the agonist will just not bind there, okay, for whatever reason. Okay? Now, what is it going to look like for effect?
Depends on the receptors.
Sorry, this is just the absence. Yeah.
It depends on spare receptors.
Exactly. It depends on whether spare receptors are present or not. If they're not present, what is the effect going to look like? If there are no spare receptors.
You won't have max effect.
Exactly. So we won't reach Emax. It's going to look very similar to this. But if there are spare receptors present, it's going to look like competitive antagonist, or very similar to it. Okay. Yep. Okay. So, in the absence, the binding is probably quite clear, isn't it? Yeah. We can never reach Bmax. For the effect, if there are no spare receptors, we'll never reach Emax, the maximum effect. Again, some of the receptors that we need in order to reach Emax are occupied by something else. We can't get there. But if there are spare receptors present, we can actually even, so imagine our example with 100 receptors, okay? And we need 50 to activate them, okay? Now, if 25 receptors out of the 100 are occupied by an antagonist, we can still easily get 50 with an agonist bound, and we can get a maximum effect. Okay, I'll repeat that. So we have a cell with 100 receptors, 50 of them are spare, and 50 of them we need, well, any 50 we need to get an effect, the maximum effect, sorry, okay? Now, we add some non-competitive antagonist, which sits on 25 receptors at a specific concentration. So 25 receptors cannot be used, okay? The agonist will not bind, or the receptor will not activate, or whatever. They're dead for us, okay? So we can never get 100% binding, because 25 receptors will not bind an agonist. The maximum we can get is 75% binding. But for the effect, we only need 50 receptors with an agonist bound. So 25 are dead with an agonist, but we still have 75 receptors that can bind the agonist. Okay? So we can get to a situation where 50 of them have agonist bound, we get 100% effect. Even though 25% or 25 receptors are not usable for anything.
But that depends on how much or how many antagonists you add those then.
Of course.
Yeah.
No, of course. Yeah, if the amount of antagonist is equal to maximum binding of antagonist, of course, there will be no effect. Of course, yeah. But the assumption here is we add some reasonable amount of antagonist and then we vary the concentration of an agonist. Yeah, of course. If you kill all the receptors, well, there'll be no effect.
Do you have an example from pharmacology?
An example from pharmacology, not in my head at this point. There are many. There are many non-competitive antagonists used in pharmacology, and if you don't use large enough dose of those, there are, for example, non-competitive. They're actually irreversible blockers of alpha-1 receptors. So they're used to decrease blood pressure. We're going to talk about that a lot more later. But they're used to decrease blood pressure. They are irreversible because they're used in situations where the body produces huge amounts of catecholamines, huge amounts of adrenaline. There's actually a tumor called pheochromocytoma that produces huge amounts of catecholamines. So what you give to these patients is an irreversible inhibitor of alpha-1 receptors, because if you gave them a reversible one, a competitive one, if you gave them a competitive one, the huge surge in adrenaline would displace the drug, and the blood pressure would go up. So you give them an irreversible one where this doesn't happen. But if you don't give them a large enough dose, they can still get a hypertensive crisis because there are spare receptors present on the blood vessels.
Can you give them too much also?
Of course. If you give them too much, then they don't have any blood pressure. So yes, of course, yeah.
In this second graph, the middle one and the bottom one.
So this is no spare receptors, and this is with spare receptors. And both of them are with antagonist, in the presence of an antagonist. Okay? Good. So the last two groups we need to talk about are partial agonists and inverse agonists. Let me just mention one more thing that I was brought to during the break, and that's the concept of physiological antagonists. I didn't really want to talk about it now, but I think it's good to mention it. A physiological antagonist is, so all these things that we talked about are related to one receptor. Okay, we're talking about one receptor, and we have drug that is an agonist on the receptor, that is a partial agonist on the, etc., one receptor. But the concept of physiological antagonist is that we have two drugs, we have two molecules that have the opposite effects on a tissue or on a cell, but they do not bind to the same receptor. So for example, we can have, acetylcholine decreases heart rate by binding on acetylcholine receptors. Okay? Now, of course, there are antagonists of acetylcholine receptors, and we're going to talk about those later. But the heart rate can be increased by activating catecholamine receptors, beta-1 receptors. So we can have a drug that acts on acetylcholine receptors that decreases heart rate, and we can have another drug that acts on beta-1 receptors that increases heart rate. These two are physiological antagonists. They don't bind to the same receptor, they don't displace each other, but their effects on tissue are opposite. Okay? So it's a concept that really has very little to do with what we're talking about now, but it's probably good to have it as that you know that there are actually physiological antagonists. Slightly different concept. Right. Let's talk about partial agonists. I said that partial agonists are agonists, they bind to a receptor, but they do not cause as much activation as full agonists. Now, when I had a lecture for Czech students, they asked, well, how does it work? Surely, if you have a receptor and an agonist binds, the receptor opens. Or an antagonist binds and the receptor doesn't open. But how can you have something in between? Half open. You know, how does that work? Does anyone know how that works? How we can have a half open receptor or something?
Maybe the ligand causes the receptor just to open for a shorter amount of time or something?
Yeah, that's pretty much how it works. So if we have, let's imagine, it's quite easy to imagine if we take a receptor that's also an ion channel. Okay? A ligand-gated ion channel. Okay? Now, the idea that they just sit in the membrane in closed state and then something comes and opens them and then they sit there in an open state is not quite right. What actually happens is that these ion channels constantly open and close. Okay? There's a thermal movement in the channel and they constantly open and close. But if they're not activated, the amount of time that they spend in the closed configuration is much, several orders of magnitude bigger than the time they spend in the open configuration without an agonist. Okay? So they're closed, because most of the time they're closed. Not all the time, but most of the time. If an agonist comes, it activates the receptor by increasing the probability that the protein is going to be in the open configuration. So with an agonist, again, it opens and closes, but most of the time it spends in the open configuration. Therefore, ions can flow, etc., etc. Now, partial agonist, when it binds to a receptor, it also increases the probability that it will be open, but not as much as the full agonist. Does it make sense? Yeah? So it really is about probability of opening. Same thing works for G protein coupled receptors, but there it's not about opening and closing, but then it's about binding a G protein or not binding a G protein. So it's all about statistics, okay? A full agonist will increase the probability by a certain amount. A partial agonist will increase the probability of opening by a smaller amount. Okay? Okay, raise your hand if that's obvious. Good. Excellent. So what partial agonists do, they don't elicit, they bind to the receptor, activate it, but they do not activate it as much as an agonist. Now what does it mean for pharmacology? Partial agonists are very interesting drugs because they behave differently depending on the concentration of the full agonist. Now let me explain that. If you give a patient a partial agonist on some receptors, and the patient in their body has no agonist, okay? So for example, let's talk about a specific thing. Let's take adrenaline, okay? Adrenaline and catecholamine that has all sorts of effects. We don't need to go into detail. Imagine a patient that does not produce any adrenaline. Okay, such a patient would be dead probably, but let's just imagine it for the sake of the thought experiment. Okay, no adrenaline there. We inject this patient with a partial agonist on adrenaline receptors. What's going to happen? Is there going to be some effect? No effect?
Small effect.
Okay, so there's going to be a small effect. So many more adrenaline receptors will be activated than there were before. Okay, we gave the patient a partial agonist. There will be some activation of adrenaline receptors, more than without it. However, the opposite situation, where there is a lot of adrenaline, the partial agonist, so in the low adrenaline situation, the partial agonist behaves as an agonist. It causes an effect. It activates the receptors. If we have a lot of adrenaline, the partial agonist will actually behave as an antagonist. Okay? Imagine our now proverbial cell with 100 receptors. Okay? In the absence of any ligand, the partial agonist, let's say, will occupy 50 or something of them. Okay? There will be some activation, even though not as big as if adrenaline occupied them. Then adrenaline comes and wants to activate as many receptors as possible. Okay? There's a huge amount of adrenaline, so normally it would bind to all 100 receptors, and it would cause a huge effect. Okay? But 50 of those receptors are already occupied by a partial agonist. That actually does cause some effect, but the effect is smaller than the effect that full occupation with adrenaline would cause. Okay, so partial agonists at low agonist concentrations behave as agonists. At high agonist concentration, they behave as antagonists. Now, I'll give you an example from pharmacology that I think will explain it much better than what I've done now. One partial agonist that's used in pharmacology is called methadone. Have you heard of methadone before? Okay, what is it used for?
Heroin.
Okay, so it's used for heroin addicts to basically try to wean them off taking heroin. Now the problem with opiate addiction is that it is a physical addiction. I mean, there's also the psychological addiction, but the body itself needs the opiate in order to survive, or to survive with a reasonable quality of life. Okay, so you can't take a heroin addict and just make them stop taking heroin cold turkey, because they would go through very dangerous and very severe side effects of that. So what happens with methadone is, you take methadone, it's a partial agonist of opioid receptors, of mu-opioid receptors. The heroin addict, or the former heroin addict, takes a methadone tablet, and because it's a partial agonist, the methadone will occupy quite a lot of the mu-opioid receptors and will prevent the withdrawal effects. Okay? So there's some baseline activation of mu-opioid receptors that prevents the withdrawal effects. However, if the former heroin junkie is not really a former heroin junkie, but actually injects him or herself with heroin, methadone will actually act as an antagonist, and they won't get the full effect of heroin.
So there's a higher affinity to the receptor as well?
It doesn't matter. I mean, the affinities don't matter. What matters is affinity and concentration. So it's just a matter of dose.
But they're not competitive then?
They are competitive. So it's a matter of dose and affinity. I don't know which one has the higher affinity, but if you add a ton of methadone, then it can have very low affinity and will still work. Okay? So it's not so much about it's about affinity and concentration, or dose. Yeah. But do you understand how methadone works? Okay? If there's no morphine nor no heroin in the bloodstream, it acts as an agonist, so it prevents withdrawal symptoms. But in the presence of morphine or heroin, it actually acts as an antagonist, and that prevents the effects why heroin addicts take heroin. So it prevents withdrawal effects, but at the same time it stops heroin addicts or former heroin addicts from having fun from taking heroin. So that's the idea of partial agonists.
How long does it work?
Methadone. I think the half-life is a few hours, so I think they take it once a day, I think. I'm not 100% sure about that.
So they can get by the day after it's the day. So they can like take heroin and get the full effect the day after.
Well, of course they can. Yeah, yes, yeah. I mean, the idea is that they actually, they want to get rid of the addiction. I mean, if they don't want to, there's nothing you can do about it. Right. So that's the idea of partial agonists. And the very last thing I want to talk about is inverse agonists. Now, inverse agonists, somebody correctly said, well, how can we have inverse agonists? Surely we either activate the receptor or we don't activate the receptor, but we can't invert the activity of the receptor. I mean, how can we do that? Inverse agonist is a very curious and a very small group of drugs, very small group of molecules, which work on some receptors. Now, the idea is that some receptors have intrinsic activity. So there are receptors that don't need any agonist in order to be activated. They're activated a little bit all the time. If an agonist comes, they become more activated. If an antagonist comes, nothing happens. Yeah, the activity stays the same. If an inverse agonist comes, the activity goes down, the intrinsic activity. Okay, I'll say that again. There are receptors that have some intrinsic activity even in the absence of an agonist. They're active all the time. Not 100% active, let's say 5% active or 10% active, but they're active all the time. When they bind an agonist, the activity goes up to 100%. Okay? If they bind a partial agonist, the activity goes up to 50%. Okay? If they bind an antagonist, the activity stays at 10%. Nothing happens. If they bind an inverse agonist, the activity goes down to 5% or to 0%. So those are inverse agonists, and they only work on receptors that have intrinsic activity in the absence of an agonist. One such receptor is Gaba A receptor, which we're going to talk about in some detail later on. But Gaba A receptors, there are inverse agonists for Gaba A receptors, which decrease the intrinsic activity of the receptor and cause some interesting effects in the body. Okay, I know it was a lot of new things, but actually it was fewer new things than it looks like, because most of it you already know from enzyme kinetics and enzyme inhibition. So the new things really are just spare receptors and this terminology. All the other stuff is pretty much the same as before. Do you have any questions? No? Okay, that's all.
Can you, once again, a bit of partial agonists? Can you explain a bit of partial agonists, like in summary?
Partial agonists bind to receptors and activate them, but activate them less than full agonists. If they're given to a patient and they just sit there, they're given a concentration. So in the body, usually, the levels of signaling molecules go up and down, okay? The effect of a partial agonist, it basically levels off these variations. Because at low agonist concentration, they are an agonist. In high, they are an antagonist. So they kind of level off the variation.
Yeah. That's just a summary, yeah.
Okay.